So our next session is titled Work in Progress, Honing Skills and Accessing Resources. And I think truthfully, as humans, we're all works in progress throughout our lifetime, right? And many of you are in progress of becoming a caregiver and or growing and adapting to your caregiver role. And as we've mentioned a few times already this morning, many of you have been called on to assume this role quickly. You don't have experience in caregiving, much less managing an illness that impacts the brain. So for lots of people, knowing where to even begin can feel challenging. But the good news is that there are resources out there to support you as a caregiver as you navigate this journey. And sometimes it's just knowing where to look for them. So in this next session, we'll share some practical tips on what's important, steps that you can follow as a caregiver, and some helpful resources to support you in the care of your loved one and yourself. So our speaker is Sandy Blackburn. She's an oncology social worker at the Abramson Cancer Center at Penn Medicine, with an interest in supporting caregivers. And what I find really wonderful about Sandy is that she facilitates 3 support groups for caregivers every month. So we have quite an expert here to share her wisdom. And so please welcome Sandy.
Thank you so much, Margareta, for that lovely introduction. Can everyone hear me okay?
We can hear you great.
Thank you. So yes, caregivers have a special place in my heart. And I first want to say thank you so much to the ABTA for the true honor of being invited today. As Margareta mentioned, I helped to start 2 separate support groups for caregivers at Penn. This is a bird's eye view looking at Center City, Philadelphia from approximately our campus. And one of the groups, the Circle of Support, is specifically for people who support a person with a brain tumor, because that is one of the patient populations that I am assigned to. I want to skip ahead and just do my disclosures first. Here are my disclosures. And I want to say a few things about caregivers because, again, I am truly honored at my job to be able to support caregivers. I feel caregivers have a powerful voice. One time a caregiver suggested, hey, we should have our own patient portal directly to the oncology team. And I couldn't agree more. I often encourage caregivers to share what they know with the doctor. A lot of times they provide what we call collateral information. Just like Dr. Peters said, the caregivers provide information that the patient may deny or not disclose. So it really can be helpful. They are true partners in the relationship with the medical professionals. So one thing I do want to say about caregivers, I hear in our groups about such meaningful and tender moments about people trying to live intentionally and finding joy. But I also hear of the immense challenges and responsibilities they face as they support, love, worry about, encourage, and care for a person with a brain tumor, often while holding down a full-time job, running a household, and perhaps caring for children, elderly parents, and pets. While every caregiver and patient relationship is different, I find that caregivers experience certain feelings that are universal. One caregiver in a group said, "We are all in the same boat. We just have a different seat." I've heard about caregivers feeling sad, overwhelmed, frustrated, angry, guilty, fearful. There's a sense of loss of control. and of being on an emotional roller coaster. That's a very common theme in our groups. They talk about strange relationships with the patient, the person they care for, as well as with other family members, and about the expectations of other family members, especially those that may live a distance. Caregivers also share about how friends have disappeared, made insensitive comments, and that no one can understand their experience except another person in the same boat, just like Lou said earlier. They talked about living from scan to scan, which we call scanxiety, trying to make sense of things, staying in the moment, and adjusting to the new normal. There can be anger that life has changed so much with the diagnosis of a brain tumor. And they see friends and others going on vacation and enjoying things that they're not able to do right now. I occasionally jot down these words. I keep a journal when I facilitate a group, because I reflect on these words later. They inform my social work practice, and they help me in future interactions with patients and families. One caregiver said it feels like they're running underwater. That's the struggle they feel. Another said they feel like they're walking on the razor's edge, trying to keep the balance. So I just want to remind you that many of the staff do hear what you're saying and value the relationship that you have with the person you care for. And we do value you sharing information with us. So the goal today is to provide, we're talking about providing compassionate care to support the unique needs of your loved ones. The learning objectives of my talk is to discover the skills to provide compassionate care to support the needs of your loved ones, to learn about the available resources to manage the diagnosis effectively, and to gain tips to navigate change and function. And we do have many, many resources that will be provided to you, as Emily said, in a future document. So I will be mentioning resources during my talk, but rest assured, you will get a list of all of them. So when I was asked to do this talk and to help people just get started with caregiving, I used the framework of a quote that I heard from the great tennis great Arthur Ashe. He said simply, just start where you are, use what you have, and do what you can. It's just so simple. As social workers, we say, meet the patient where they are. And we often look at, what do they have? Do they have financial means, social capital? What do they have in their environment? And then we start from there. So look at the whole picture. Where are you right now? You could be at any one of these stages. Each one presents unique challenges, but also unique opportunities for growth, and even to maybe develop a closer or different relationship with the person that you care for. We look at what you have. Everyone here has a medical team, oncology social worker or a case manager, the American Brain Tumor Association. And with the ABTA, you get a community of caregivers. You may have a community of caregivers where your loved one gets care with various support groups. You do have access to information. You have personal strengths. Each of you got to where you are today using the strengths that you inherently have. And most people do have family, friends, and neighbors. So what you can do, I put together 4 C's to use as a framework for this talk. Everyone here can communicate, coordinate, connect, and care. So when I was developing these different 4 C's and putting the slides together that you'll see, I noticed that I always felt communication was primary, so we'll start there, but there's so much coordination that caregivers do in the journey. communicate with your loved one is number one. Others have alluded to how close that relationship is. If you are a spouse or partner, especially, one caregiver called that relationship one brain with two bodies. That's how closely that you walk that journey with your spouse or partner. But number one, at diagnosis or at any different stage, any different change in function or status, just check in with your loved one. That's what we recommend. How are they feeling about things? And try your best to actively listen. One thing I do want to mention is consider authentic communication versus putting on a positive face. One of the most common things I hear is caregivers saying, got to be positive. It's like being a cheerleader. And when everyone in the family, and usually it's adult children and the spouse, are putting on a positive face, they may not realize that the patient's doing that as well. I call that the masks of cancer. People are actually wearing a mask. It may not be their authentic feelings, yet when you feel that you're able to say to your loved one, oh, you know, the scan's coming up, I feel scared, that actually might open the door for them to say, yeah, I feel scared too. And it may lead to deeper conversations. It may lead to communication that is, like we call, more authentic. And things can be said that may otherwise have remained unsaid. Very important things can be shared, especially at a later stage. And of course, seek additional support as needed. Usually with a cancer care facility, there's access to a counseling service or a support group. And then communication with others. This is a big, big topic in our support groups. Ask your loved one. When we say you're supporting their unique needs, they have the right to say who gets this information, what information they want to share, when to share it, how much to share it, and how to share it. Ask your loved one. What we see in our groups also is problems when the patient is not ready to share, or when they say to their, especially spouse or partner, don't tell anyone. They don't want the neighbors to know. They don't want their colleagues to know. And that can be very problematic. I was looking at some notes before this talk, and where someone noted their spouse would not allow them to share their diagnosis with anyone, and they felt trapped and isolated. So it actually shuts off support for the spouse, and they have to seek private sources of support, like a support group, because when they have to keep a secret from their circle of family and friends, it's a lot of work. It's a lot of work to keep a secret. They may not be able to keep that secret for long, and it actually prevents both of them from getting help that they usually can benefit from. Sorry about that. Okay. So again, communication matters. When I started to do this slide and not actually name how many people are involved in just one person getting a diagnosis, this doesn't even include the medical team, of course, but these are the people that one person and one family may interact with. And all of these people are impacted one way or another by this person's diagnosis. So that's why it's really important to check in with the patient and say, look, we have all of these people that care about us. How would you like to move forward with sharing the information? I'm sure as caregivers, you can also share some stories of when communication is not extended to others and all the problems it can cause, I know, of course, I can understand where a patient may not want to share with their employer, but if they, eventually problems may emerge and it may come out by the symptoms they have that they are having problems with cognition, and the employer often has the health insurance anyway. So it really is worth a talk with your loved one about the importance of sharing the information and getting support from others in your friends and family circle. A special note about children, teens, and grandchildren. I usually ask patients, do they have children in their lives? Why? It's because children can be impacted as well. I've had families that don't tell the children, and yet the children, depending on their age, pick up certain things in the environment. They may notice people are whispering. They know something is being held from them by the way people act. And actually that kind of the keeping it a secret from children and children knowing that something is different can be scarier to kids than actually telling them what is going on. So we do recommend you don't have to tell kids the whole truth, but the developmentally appropriate truth. And what kids want to know is they will continue to be cared for. Sometimes kids are focused on themselves, like, can I still play baseball? Yes. Our neighbor will be picking you up after school instead of me on this certain day. So we usually can ask families to consider using the names of the illness, avoid euphemisms, assure your child they'll be taken care of, and discuss that the disease is not contagious. So I do recommend that you seek materials that are written by professionals on talking with kids. One of the resources that you'll be given is the Helping Children Cope booklet from the Abramson Cancer Center. Oh, and also there are peer support programs. One of them is called Pickles Group. Another is usually offered by the Cancer Support Communities. That includes Gilda's Club. So there are programs, including Camp Kesem, which offers a week-long sleepaway camp that's free for kids ages 6 to 18, Camp Kesem. So that'll be in your resources as well. Another form of communications is with the care team. So ask your loved one, do they need your help? Sometimes they want to be as independent as possible. If they would like your help with communicating with the care team, discuss shared access to the patient portal. They may need to formally contact the hospital or care facility to have you added on as a user of the patient portal. What else do you need? Check with the facility. Do you need a HIPAA form? We do. We request that a patient sign a form so that we can disclose information to whoever they designate. And then also make sure with your oncology team that your current information, your own cell phone, your email, everything's current and accurate so they can reach you. And of course, this is a good time to open the door and talk with your loved one about an advance directive or power of attorney, and if that has not happened yet. So again, coordination is one of the biggest tasks of a caregiver. There's the health insurance aspect, and really it's a benefit to you and the person you care for to really know what that plan covers. If you're going somewhere for a second opinion and decide to stay, or if you're just having the first visit, is that plan accepted? Is that care facility in network? You can contact the plan directly to learn if there are copays, deductibles, limitations of any type of services. Sometimes PT and OT have a certain number of visits per year with an insurance plan. We have financial advocates here at the Abramson Cancer Center. Ask if you have advocates there. Their sole job is to talk with patients and families about insurance. And a lot of times patients lose insurance. They need to find a new plan. They need to find one without a huge deductible, or that of course is covered. It covers the care at our facility. You also may have access to a case manager or care manager with your insurance plan. So some insurance plans offer a point person to you when a patient has a serious or chronic illness. There may be someone at the healthcare plan kind of in the background overseeing things, where they know about the expected services and costs, and that can save you a lot of time when you call the insurance plan just to find out, hey, is a hospital bed covered, or just different things. Because as we all know, when you call an insurance company, it can be press this button, press that button, and then you can be on hold a long time. So see if there is a case manager. Just call the usually the patient service number on the insurance card. And then how do you even schedule appointments? Make sure you are aware of who's the point person. Do you do that through the patient portal? Should you call? Is there a nurse navigator at that site who can help you with appointments? We have nurse navigators here at Penn. And then sometimes the oncology team might say, schedule an MRI, and you try, and the appointment is maybe several weeks ahead. Make sure you let the medical team know if you're unable to get a timely appointment. Sometimes they can intervene. A big major task is to stay organized. So everyone has usually a way that they try. Nowadays, it may be apps to help you keep track of different aspects of your loved one's care, appointments. Maybe it's tied in with the calendar. Who are the staff names at the cancer care facility? It's really great, as was noted earlier, to find out who the name of the oncologist, who is their nurse practitioner or physician assistant, who is their administrative coordinator. Just who are the people that you will be interacting with frequently. Just keep that information together. Some people might have a simple notebook, and just have a daily log, just a sheet of paper for each new day, what transpired that day. That can be great for references, for information needed. Another tip about calling an insurance company is, if you're getting an answer on a covered benefit or something notable, ask if there's a reference number for that call. Because if that's ever challenged, if you learn, for example, some medical equipment is covered during the call, get the reference number. If that is ever challenged by the insurance company, you can use that reference number. Okay, this is one of the biggest tasks of my role, is just helping people coordinate transportation. We are lucky enough to be in a big city, and there's lots of local, there's a great public transportation system here in Philadelphia, but people do travel from all areas, and there's people from rural areas. They may travel here, even people coming that require flights and longer distance coming for care here at Penn. So I would say your oncology social worker is the best resource for this information. Yes, the American Cancer Society does have a ride to recovery program with volunteer drivers. May not be available in all areas. Transportation is not typically covered by health insurance plans. It may be covered by Medicaid, also known as medical assistance plans, and some Medicare Advantage plans. So you want to check with your insurance. In each county, there is an area agency on aging, and even if your loved one is not a senior, they also may provide services to those that are considered disabled. Even your local public transportation agency may have a paratransit service for those who are not able to use public trans, but they might have a wheelchair van, for example. Of course, there's always private pay, Uber, Lyft, stretcher ambulances for doctor's appointments typically are not covered by insurance. That can be a huge cost to families. So check with your plan in advance and see if that's, of course, I'm referring to non-emergency stretcher ambulances. Some people have used Uber or Lyft in this area for, they may offer a wheelchair van. And that's surprising to a lot of people, but some Uber or Lyft drivers may have a vehicle that actually it is a wheelchair van, or families have rented a wheelchair van. But yes, your oncology social worker is the best person to check in about that. And I say, when you're coordinating change, you're navigating through something has changed in your loved one's medical condition, just be prepared. Things can change quickly. Back to an ongoing conversation is what we recommend with your loved one. When you're talking about meeting their unique needs, it really is respecting their patient autonomy. What are their goals of care? What it may be different at the time they're newly diagnosed from later on, when after surgery or after radiation treatment, their goals of care may change. So I say that should be an ongoing conversation between the patient and their medical team, but also with you as the caregiver, so that you're both united in that goal. The patient may want a second opinion, but again, make sure they have an advance directive. Those advance directives also can be part of an advance directive, can be known as a living will. That can be changed a number of times. So it's the first one a person does can be overridden by the latest one. So that can be changed as well. And then what I recommend is also learning about palliative care, which is, supportive care. Here at Penn, we have a palliative care outpatient team. Actually, they can come in and see the physician or nurse practitioner, and it's an extra layer of support for pain and symptom management. But also, if there's a later stage that your loved one may be in, I recommend in advance learn about hospice. The National Hospice and Palliative Care Organization, which is listed in the resources, that's a great source. If you know of a local hospice, they may just offer an information session with you at no cost, with no obligation, of course, to sign on, but just to know about hospice services ahead of time. Some people think hospice is a place to go and reside, and usually it's not. Largely, hospice care looks like a home care service that's provided wherever a patient resides, whether it's in a private home or a nursing care facility. So it's really good to know about that before the time of need. Also, ask your loved one if you feel that you need additional help with another care, bringing another caregiver in, changing the level of care. There are so many families that I speak with about caring for someone at home versus having the person reside in a nursing home or skilled care facility or rehab. There's a lot of rules about going into a facility. Some people think you can go from home into a rehab facility. There's really a lot of rules about that. And so I recommend that you look at some of the resources that I listed, especially the National Institute on Aging and the National Cancer Institute. They have some guidelines on long-term care facilities, and knowing about those places ahead of time can be really helpful and alleviate stress. So yeah, along the course of treatment, even from a hospital discharge or a rehab discharge, that's when you're planning to bring your loved one home. So there needs to be the sufficient infrastructure in place, the equipment needed, or the number of caregivers, a home care team. So if your loved one is admitted in a hospital or a rehab, I recommend connecting with the social worker there early on, to say, maybe you don't have anyone besides you at home, or maybe the patient lives alone. They need to know that in order to make a safe discharge plan. And then ask the social worker at the hospital or rehab for resources. It's always a family's choice of what, if a person goes on hospice, which agency to use, if they go into a long-term care facility, or if they engage with the home care agency. That's always your choice, but it's best to know in advance, and have some things at the ready that you might need. And again, here's a couple of different resources to learn about finding a long-term care facility, nursing homes, assisted living. Sometimes you do have to see what maybe, if it's skilled care, what's in network with your insurance. If it's not skilled care, does the patient have a long-term care facility? Otherwise, many things are self-pay. So it really is best to look at these things in advance. And then the financial aspect of things, as far as employment, disability, finances. I put a lot of acronyms here, but it's really good if the patient is employed. Check with the employer, how much paid time off do they have? Do they have a family medical leave? Are they protected by the Family and Medical Leave Act? Usually that's for if you have 50 employees or more, and you've been employed in a place for a certain amount of time. Do they have a leave of absence? Most importantly, do they have a short-term and a long-term disability plan? Has the patient paid into the Social Security disability insurance system? Usually that's 40 quarters of work history. Some of the brain tumor diagnoses, like a glioblastoma, do make a person eligible for an expedited approval process, but maybe not necessarily getting the Social Security money sooner, but just they will help speed it up. Some of them, the diagnoses fall under what they call compassionate allowance diagnosis. Find out if the person ever purchased a private policy for disability or long-term care. Triage Cancer is a wonderful national organization that covers these areas, and you can request to speak with someone through their legal and financial navigation program. They don't serve as your attorney, but they can point you to guidance and information. Also, check with your oncology social worker about grants. I refer quite often to the ABTA helpline, the care line, because they can navigate someone through possibilities for grants, but your social worker should know of grants. And also, Cancer Care is a national organization. They're wonderful. Cancer Support Community, all of the numbers are in the resources. Okay, so connect with your loved one. At a recent support group, someone told a beautiful story about trying to make his wife smile each day, and it just brought tears to the group because it reminded everyone, as difficult as things are that you're going through, you can try to be intentional and find some fun moments with the person that you care for. If you're caring for someone, there was a relationship that pre-existed the cancer diagnosis. So you want to nurture that relationship, like Lou so wonderfully shared, but connect with yourself as well. with self-love, and find a space to identify and process your feelings, whether it's with a trusted friend or loved one. Supportive others, check in, connect with your family, friends, other caregivers. Someone told a wonderful story of a very supportive friend who they would meet for lunch, and she would say right at the top of the lunch, do we talk about cancer today, or do we talk about anything but cancer? And that was just a wonderful invitation, that the caregiver had the choice of, do they want to just be free, take a break from cancer. So I thought that was something that I do share that with others, because I thought that friend's insight was very considerate. And then, of course, we say care for yourself. I know that's easier said than done. That can sound very trite, to take care of yourself, but as we're all reminded on an airline flight, you put on your oxygen mask first before you can take care of others, right? Also, I like to say to people, each day we wake up with maybe a full battery, but all day long that battery is drained. And with a caregiver tasks, it's drained with things that are for others, always for others and attending to their needs. So what do you need? As Lou said, keep up with your own health care and take a break and respite if you can. Some insurance plans actually may have a respite benefit. So that's when your loved one may go into a care facility for a week or so, or there may be other ways that maybe an adult day center. I don't know about home care in every situation, but that's where your insurance company will pay for someone to care for your loved one so that you can get a break. There's also, depending on where you live, there may be organizations, cancer support organizations, that offer a respite trip. We have one in the Philadelphia area, and they send a family to an all-inclusive resort in the Poconos here. So ask your social worker, is there something like a respite where you and your loved ones can get a break from cancer? And spirituality. I serve on the spirituality special interest group for the Association of Oncology Social Work, and we consider spirituality as just looking at the whole person. It's individually defined. There's so many definitions for spirituality that there's not like an official one usually. But as we know, a cancer diagnosis may cause a person to search for meaning and purpose. And that can be very difficult depending on so many factors, depending on the person's spiritual history, depending on their age. Can a person find meaning in this? Maybe not. Can they find, I've had people say one young person, she lost her hair, and she actually thought that was, God's way of sending her a message that she was too focused on herself. And she put a meaning on that. And so she became a person, a different kind of a person with a different perspective, according to the meaning that she assigned to that. But remember that religion can be a strength or a stressor. People can, if they have a belief in God or the divine, they can be angry, feel like they're being punished, and wonder why. They ate right, they did things right, and they can't understand why they were singled out with the diagnosis. Or it can be a strength. People can either return to a prior religion that they were affiliated with, or find a new faith or new religion, and really can be encouraged. But again, usually there's a spiritual care provider affiliated with each cancer care team. So again, back to the open and honest communication, check in with them. We want you to be, we want to promote your well-being in order to care for your loved ones. So if you can have these authentic conversations, what is most important right now to you both? Maybe you both can see a therapist together, or maybe you need that separate time, individually. What's most important at each of different stages. So the American Brain Tumor Association has a list of support groups that in different places that you can ask for advice of finding one if you don't have one at your facility. And also you can ask, again, back to the oncology social worker for a therapist, spiritual care provider, or clergy. Now, when I say care for others, the first thing that I will advise is ask for help, because as someone said earlier, this is a marathon, not a sprint. And I recognize that when you're caring for others, it's hard to ask for help. People have said, I'm the one that used to give help to others. So there are some websites that you can sign up for. One of them is from Cancer Care, and they have a website where you can put different tasks on there. Like, yes, we need the lawn mowed. We need the kids picked up on this day. We need some dinners. Maybe think about taking advantage of that. And when people say, how can I help? Have something ready to say. Or maybe you have someone in your friends or family circle that you can assign as the point person, kind of like a personal assistant. And when people say, how can I help? You can say, talk to Mary. So one other thing that I want to say about communication with others, people mention how hurtful it can be when people look at your loved one and they say, oh, John looks great, but they don't know what's happening inside. They don't know what's happening emotionally with the patient or with you. I would say have a ready answer. I don't, thanks for asking, appreciate your interest, but today I prefer not to talk about that. Or we also know that caregivers don't get the attention that the patient does. Everybody asks about the patient. So maybe you can use humor. When the millionth person has asked about your loved one, how's John doing? You can say, I'm doing terrible. Thank you very much. That was something that a caregiver mentioned one time. So remember, it's you're not invisible to us, but to others, they're focused on your loved one, and we want to get the caregivers the proper attention they need. So within the resources, there's something called the Caregiver Bill of Rights. And I want to close on this note. In the Caregiver Bill of Rights, the right number one is, I have the right to take care of myself. This is not an act of selfishness. It will give me the capacity to take better care of my relative. So keep that in mind as you move forward in your caregiving journey. You have this right to take care of yourself, and try to exercise that right as much as you can. So I will point you to the ABTA for many services. I refer so many people all the time to the ABTA for their care line, and especially the caregiver booklet. That is great. And here are just some, a quick showing of the caregiver resources. There's 5 pages of resources here. Here's the camp I mentioned for kids. Here's the booklet I've mentioned, Helping Children Cope. There's the Family Caregiver Alliance. Lots of good information from the National Cancer Institute. Of course, we recommend reliable websites. There is something, if you feel that you are in crisis or need help, there is the National Suicide and Crisis Lifeline. The phone number is simply 988. I'd like to highlight that, just 988. The other thing I wanted to mention, Oncolink, the internet's first cancer information website, actually started here at Penn 28 years ago or so. They have create a treatment binder. So they have, they offer you an organizational system where you can download different bits of information on different drugs your loved one may be on, or treatments, and you can coordinate that in a binder if you want to use that system. And here's additional resources, triage cancer, and if you're a veteran, here's the veterans information. So here's a disclaimer. I'll just show that for a moment. And thank you. Thank you so much for inviting me. Time for questions.
Thank you so much for that great presentation. Just as a reminder for our audience, if you have a question that you'd like to ask, please type and submit it using the Q&A button on the bottom of your screen, and we will answer questions as time allows. All right, one of the first questions we have here goes back to one of the C's you talked about and the importance of communication. This attendee, they feel very alone in this experience. Their spouse has severe aphasia, so they're not able to speak. They also have other cognitive challenges. What advice can you provide in with that communication piece of trying to understand what the patient needs and checking in with the patient when you're not able to talk to them, or talking or writing even is not an option?
That's a great question. I would say is there a speech therapist, speech and language pathologist involved in the care? Because sometimes they have communication aids for people with aphasia. I think it's the National Aphasia Society. That I don't have it handy, but I've heard that there are, communication charts or different ways to communicate when someone has aphasia. So I would ask if you can get the doc to write a script to see a speech and language pathologist for that. But yes, it can. But of course, as a social worker, I'll say, feelings can be expressed in so many different ways through actions. And I know that it won't be as easily two-way as it was before, but there's expressions of love that surpass, the ability to speak. So the person's favorite meals or flowers or going on a nature walk, hugs, lots of hugs.
Thank you so much for sharing that insight. You also talked about advanced directives. Can you just explain a little bit generally what an advanced directive is and how a caregiver or patient can go about completing one? And in your opinion, when is the right time to have that conversation and get that completed?
Maybe I'll speak on behalf of my care facility. The right time is now. And the right time is in advance of need. So when a person comes to our hospital for surgery or a procedure, I think sometimes as a new patient, we say, do you have an advance directive? Because the sooner you complete one and think about those things, the better. And so Triage Cancer is a great resource for advanced directives. Each state might have a little bit of a different requirement as far as does the document needs to be notarized or not. And Triage Cancer has usually state by state information, but your oncology social worker is a great resource. There are some generic documents out there that may be acceptable in most states. One is called Our Care Wishes. OUR, Our Care Wishes. That might be accepted in mostly every state, but documents, these are advanced directives is an umbrella term for something, a document planned in advance, which can be a living will, which indicates a person's care wishes if they cannot speak for themselves. So if a person comes to a point where they cannot say, I want this procedure or that type of care, then they in the living will, they can articulate exactly what their care wishes are and they can appoint someone that is a power of attorney, like a medical power of attorney. So it takes care of two different things. Some documents are just one, or maybe some are combined. They vary. In Pennsylvania, it can be written a million ways. There's not one official document. So I would say turn to your oncology social worker, because they may have a sample but you can actually use that sample document. And other people purchase on just online, but other people go to an attorney and do something more formal. So it's a million different ways that you can do that. And also share with your care facility so we have it on file.
Thank you so much for that overview of advanced directives and how to go about that process. We have a question here about home help and care at home. Is that something that is covered by insurance? Do families have to request that through their hospital? How can a caregiver or family member get more support for caring for their loved one at home?
Excellent question. Usually skilled care is covered by health insurance. So that means a nurse, a physical therapist, occupational therapist, speech therapist. Once you have those team members in place, insurance often will also cover a social worker at home, which of course I always recommend adding that social worker to the team. And also maybe sometimes, depending on if it's a home palliative care program, you might have a spiritual care provider. But often this may be the only time you have access to a home health aide. And that home health aide is generally coming for maybe an hour, 2 or 3 times a week, and they can help just with personal care. It's very narrow, bathing and dressing a person. Generally, things like what we call custodial care, things like preparing a meal, doing laundry, just being a companion and sitting with a person, that is generally not covered by health insurance because it's not skilled care. So talk to your doctor about writing a home care order. Of course, a person needs to be considered to be homebound, and that definition may vary in different states. But if they're considered homebound and a doctor feels they need a nurse, PT, OT, speech, yes, ask for the order.
Thank you. And a follow-up to that, this actually came up in our last session when Lou was talking about that experience she had at home where the home, I think it was nurse, was going to go try to wash or clean the surgery site. Can you talk a little bit about whose role is it to educate the, if it's a home health aide or, someone coming to help at home, educating them on how to ensure that the care is proper based on what they learn from their healthcare team? Because we hear from caregivers that it can be very exhausting for them to have to play that role of reiterating everything that they learned from the hospital to now this person coming at home to really is supposed to help to relieve that stress, but sometimes it can add more to it as well. Can you provide any advice on just how to navigate that and how to communicate that so all of that weight isn't on the caregiver?
Yes, great question. Ideally, there would be communication between the home care team and the ordering physician, ideally. Here at Penn, we do happen to have Penn Home Care. So it's so easy for the home care team to look in the computer and see the patient's entire history. I know that's much more difficult when it's an outside agency not affiliated with the healthcare system. But in theory, a home care agency, of course, has to be licensed, and they should be providing appropriate level care. And if it's for caring for someone with a brain tumor, here at Penn, we would typically put them on the palliative care home care team. So palliative care home care, if you have that in your area, I realize it's not available everywhere, but typically it's the nurse on that team that may have some additional training, and that team would be more in tune with someone with a chronic or serious illness, more so than maybe the average home care team, which might come out for, typically maybe a person has a hip replacement and they're out for a couple weeks to take care of the wound and then they're gone. But a person with a brain tumor should have the level of care that of a home care team that is trained to take care of that. And I just don't see any other way than the caregiver to continue to be vigilant about advocating. And if you see something like they're not doing the right thing, ask them to call the doctor. I mean, the doctor has ordered this care, and I mean, they should be familiar with what, the needs of the patient that they're caring for. So just encourage that communication, and even contact your oncology team and ask them to call the home care team, and just have the care needs explicitly expressed. A lot of times hospitals, other hospitals, home care agencies, they might be able to see electronically. There's a program called Care Everywhere. They may be able to see in the patient's chart, but if you don't see that two-way communication, encourage it.
Thank you so much for that insight and for that great advice. Another question we have is asking for help. You shared that very important piece of advice. Can you provide some guidance or tips for caregivers who don't have a support system where they're able to reach out to, maybe extended family or friends to take something off their plate? Where can they turn to for support or getting some of that help so it's not all on them?
Yeah, this is a big challenge for a lot of people who the patient may live alone. They may have no family. They may have estranged family. I never assume that people have a big care circle of family, friends, and that they're well connected, because they're simply not. So again, I would point to the oncology social worker, so they know that you have very few people or no people to help. And that's a time where that oncology social worker may know of community resources. It depends. If a person has Medicaid, for example, they may actually be able to get an aid, depending on the state, a caregiver aid if they have Medicaid, and that's an extra support in the home. They may know of local faith communities or other communities that might have access to volunteers, or but usually that's supportive care, like bathing, dressing. Another good resource is the local area agency on aging. Even if your loved one is not a senior, just reach out to them. They also may have a caregiver program for support. The state may have a caregiver program. That's why I think it's so important to connect with your oncology social worker. They should know of the resources. We have lots of people with not a lot of support, unfortunately, but the oncology social worker, if you have one usually everyone has one at the care facility, but if you have home care, try to get that home care social worker in. I call them the boots on the ground. They can look around the patient's environment and see what resources can be pulled from established, county and state agencies that might be able to provide extra support through caregiver programs.
Great. Thank you so much for that guidance. I think that is all the time that we have for questions for this session. Thank you so much, Sandy, for your presentation and for your wonderful answers. I'll turn it back to Emily and we'll move forward with the rest of the program.
Thank you.
Yes, thank you so much, Sandy, for sharing with us all these practical tips and helpful resources for our caregivers to support their loved one. As mentioned, each of you will get a copy of all these wonderful resources shared post-event. We are now going to take a break for about 10 minutes, and we'll resume our program for our next session on coping with loss and grief. See you back shortly.